biotech firm called Science Corp has released what may be the next cochlear implant, except this works for vision and has already restored vision in clinical trials. If this sounds disturbingly familiar to you, it's because it's not the first time that it's happened. We've restored vision in people who were blind using brain-computer interfaces and cameras that they wore on their eyes. It was amazing technology. However, when that company went out of business, people lost their vision. Not just lost their vision instantly, because they didn't just take the implants from people, they slowly became obsolete as the technology was unsupported. Yes, this is the risk of having cutting-edge technology created by private firms. If it is not financially beneficial, it is simply not going to be maintained. So it's almost like giving someone a little glimmer of hope and then snatching it away. Within biotechnology and medicine, implants are created and they're often used for clinical trials, and then maybe they never go to market. At that point, a company can coerce someone into removing their implant, even if it's life-changing, even if they want it. Leaving medical implants in without anyone to maintain them opens up companies to a whole lot of liability, and they would prefer people simply removed them. There is a whole heck of a lot of regulation in this area, but not enough for after a trial is over. As for how our eyes work, we can talk about it because it is much more reasonable than other brain-computer interface technology that requires neurosurgery in order to use it. This requires eye surgery. Now, this is applicable to people who have lost the ability to sense light and color. It may not be applicable to people who have lost the optic nerve because it does interact with the optic nerve. Patients have a tiny chip inserted under their retina, and then they wear smart glasses that communicate with that chip, and then that chip stimulates the optic nerve in order to create images, and it is highly effective. After a year, most people were able to be corrected to 2042, which is better than my vision. 2200, 2175. Not great. For other implants, like the one that goes in your ears, your cochlear implant, it's used to restore hearing, and it is commonly used and widely approved, so this really could be game-changing. This kind of technology coincides with robotics as well as prosthetics, and we are really lucky that AI in robotics has been studied to such an extent because it also means that prosthetics get to advance. Sensation is just data, and data can be interpreted, and we can create artificial intelligence that is able to interpret the very same information as our brain can interpret, and that is also one of the reasons that we get this technology. This is, by the way, much more in line with local processing, which is a lot more similar to how our brains and bodies work than being sent back to a computer to be interpreted before it goes to our brains. It is actually horrendous how much technology has been developed and could be used to help patients, but it never gets used because it's just not profitable enough. At least we are studying robotics to the degree that we are, because otherwise a lot of this stuff would not exist, but let's talk about some of that stuff. One of the problems with prosthetics is that people can't feel it. So yes, it could be useful in theory, but if people cannot experience it, then they're not encouraged to learn how to use it. The solution may be brain-computer interfaces, and yes, this is already used in some lucky patients. They have a brain chip, and that brain chip allows them to experience the world through their prosthetic. I do like to talk about the risks when it comes to neural surgery, because anytime you go under the knife to insert a chip into your brain, you have the risk of doing serious damage. However, when it comes to medical treatments like prosthetics, it may be worth it. I am pretty against it to just interact with your phone, and that is an option. And we are talking some pretty serious discernment. The same technology that allows a robot to be able to pick up objects and identify them by touch is the same thing that's allowing us to use these robotic limbs. And legs, too. However, there is one very big risk to all of this. There is, however, one massive risk, and that is that we are modifying our bodies with technology that could very soon be obsolete. If you think about just how fast AI is moving, just how fast robotics is moving, a lot of the people who get this technology cannot really afford it. And then they're going to have to be able to afford to replace it, especially when it comes to something that is going to be put in your brain. So even if a company continues to exist, there is no guarantee they're going to maintain old technology. There's no guarantee that you'll be able to pay to replace it or even be able to medically. This is one of the reasons that medical treatments do not easily make it from the lab to people, because we have to make sure that this is the best way to do it, because we cannot afford to make mistakes. That does not just mean potentially harming a patient, that also means potentially hamstringing the entire industry if there is a scandal. And I love to talk about science scandals here and there. The other thing I really want to say is that I often hate how slowly medical advancements happen. There are so many great treatments that are being studied in mice, like, say, brain organoids for strokes, that just have not made it to human trials yet. And I really wish that were not the case, but there is very good reason for it. If you have a pacemaker, for example, that's put in your heart, and it's 20 years old technologically, at least you know that it's going to be supported in the future, and at least you know it works. There's no major problems that we just haven't figured out yet. My greatest fear for things like robotic eyes is that this technology comes from robotics, and it will continue to come from robotics, and that is probably going to progress faster than medical treatments are going to be capable of progressing. In other words, our bodies could become obsolete to technology that's already being made for more profitable endeavors. Either way, the technology is really exciting, and I'm very hopeful for it, and as it progresses, I will keep you up to date. I hope you've enjoyed this. Follow for more.